Good afternoon, everybody. We're going to get started in about 5 minutes, so just hold tight. Good afternoon, everyone, and welcome. Thank you all for joining us today. We are excited for the next opportunity to present to you our free webinar Wednesday series. Today, Welltality is bringing to you how to create revenue capture quality measures and close care gaps through the Medicare Annual Wellness Visit. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You should see an attendance interface on your computer desktop in the upper right-hand corner. You can listen in via your computer speakers, or if you would prefer to join over the phone, just select the telephone in the audio pane, and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenter by typing your questions into the questions pane on the control panel. You may also send in your questions at any time during the presentation. We will collect these and address them during the question and answer sessions at the end of today's presentation. With that, I'm going to introduce to you Ellen, who is with Welltality, and I'll turn it over to you, Ellen.
Sam, thank you so much. I appreciate it. Hello, everyone out there. It's nice to meet you all virtually. My name is Ellen Heekin, and I am the Director of Sales at Welltality. I'm going to be doing this webinar with my partner, Terry McGowan. He is the Vice President of Operations here at Welltality, and we're going to be here to help you enjoy your lunch hour, talking about some really exciting things like Medicare Annual Wellness Visits, HEDIS measures, and guidelines. I know all of you are so excited about this, and I do appreciate you being here, and I look forward to getting started. We are really excited about our partnership with Flacos, and very excited about teaching you all about annual wellness visits and how you can create revenue, capture quality measures, and close care gaps through the Medicare Annual Wellness Visit. So with all that said, let's go ahead and get started, and I just want to thank you again for attending this webinar. Okay, so I'd like for you guys to think about some things. I'm gonna talk about a couple of questions that I would typically ask if I was sitting on a one-on-one presentation with you. And I want you to kind of just keep these questions in mind as I'm going through the presentation. And they're pretty simple questions, but just kind of have an idea of where you're at currently with your practice and how you are doing with your annual wellness visits. I know that I'm speaking to a very sophisticated crowd out there, but I do find that some people still are a little uncertain about all the things that are supposed to be done during an annual wellness visit. And I'm going to get to that, and I'm going to speak to everyone in the room, but I promise we will get through this quickly. And I promise you will probably learn at least one or two things today about Medicare Annual Wellness Visits. So the first question I want you all to think about is, how many Medicare patients do you have? Do you have 500 Medicare patients? Do you have 3,000 Medicare patients? Do you have one physician that's doing a really good job of Medicare Annual Wellness Visits, but then you have 3 other physicians that are lacking in getting their annual wellness visits done? So keep that all in mind with how many Medicare patients do you have? And how's it going with your annual wellness visits? Are you guys getting those patients in? Are you guys having success with scheduling, or are you having a hard time getting those patients in? Or are you just capturing them on the way out? How is it going with your annual wellness visits? I think some of you are probably saying to yourself, we're doing pretty good. Or there may be some of you out there that are saying, we could really be doing a lot better. Because there is a lot that is involved and goes into the annual wellness visit. The third question is, who is doing your annual wellness visits? Is the provider spending 30, 45 minutes to do these annual wellness visits? Is it a mid-level or an ARNP or a PA doing these annual wellness visits, spending that 15, 20 minutes with the patients? Or do you have a team of medical professionals under the direct supervision that are helping with your annual wellness visits? And that's something that we're going to talk a little bit more about, because I found that to be one of the most exciting parts of the annual wellness visit. The next question I have is, are you capturing quality measures? Are you capturing those HEDIS measures? Are you getting BMI documented, blood pressure documented, pain scores documented? Are you doing a fall risk assessment? Are you doing a whisper test? Ask yourself those questions and make sure, because this is an excellent opportunity during an annual wellness visit to capture quality measures. For those of you that were at the Flacos conference, I think you probably heard more than once, quality measures equals shared savings. The annual wellness visit is a great opportunity and a perfect time to capture quality measures. What does the care plan look like to the patient? What does it look like to the physician? We're going to get to that in just a minute, but are you creating a care plan? Is your doctor going and visiting with the patient for 5 minutes, 15 minutes, and then going back to his office and spending another 5 to 10 minutes creating a care plan? It is one of the things that must be done during an annual wellness visit. It's allowing you to bill this code compliantly, and we'll get to that in just a minute. The next question I have is, are you compliant with Medicare coding? Are you billing G0438? Are you billing G0439? Or are you billing a physical, a 99397, I think it is. So that's something else that we're going to talk about. We are talking about annual wellness visit, and the code that we're referring to is the G0438 and the G0439. Okay, let's talk about one of the biggest problems of annual wellness visits. So everybody knows how important it is to get these annual wellness visits done. We also know that they're time consuming, and we also know that it takes a lot of heavy lifting with scheduling. We know that it's important to the insurance companies and the health plans to get these done, but how are you specifically doing in getting them done? So in 2015, the advisory board got together and they determined that we have given you this beautiful code and it pays really well, but you're not getting them done. So basically, they came to the statistic that the average physician is performing 17.9% of annual wellness visits in their Medicare patient population. And what they determined is that not only are these physicians in the primary care world leaving a lot of money on the table, they're missing that opportunity to capture those quality measures through the Medicare Annual Wellness Visit. So this is a huge problem, right? The doctors know it's important, the health plans know it's important, and the administrators are trying to get this visit done, but they're just not prioritizing it. And it's really important to make the annual wellness visit a priority. Number one, it pays well. It's important. Number two, it's important to the health plans. And number three, the patients want their one free visit a year. They want this opportunity to see their provider or see their mid-level and talk about their medical history. So if you think you're falling in this average, you're very similar to a lot of people out there. Now, again, I know that there's a lot of people on this call that are maybe doing 30, 40%. So kudos to you. That's fantastic. But we got to get you closer to that 75 or 80%. And that's what we want to do here with Welltality, working with you guys. So let's go to the next slide. So ACOs typically have about a 25% patient churn each quarter, right? So the churn disproportionately affects the healthier patients with the least cost. So let's use an example with a $10,000 benchmark. And you all know what your benchmarks are. That might be a different number, but we're just going to use a $10,000 benchmark. So we're going to talk about the healthier patients, right? Managing the churn on healthy patients could potentially bring $10,000 in revenue for each patient with little to no cost. So it's important to prioritize this visit as the annual wellness visit. And so we have several clients that we prioritize specific panels for them. So you're thinking in your head, I have 200 or 300 patients that we haven't seen in 6 months and we need to get them in. Though that's exactly who I'm referring to here in this specific example. So you have, maybe you have 2,000 Medicare patients, but you haven't seen 500 of them in 8 months. And those are the healthy patients that just don't come in, but you want to capture that information. So you might say to me, hey, Ellen, what I want you to do is I'm going to give you my 2,000 patients, but I want you to focus on these 500 and getting them in the beginning of when you get started with us. And so we would prioritize that list and we would help schedule those patients. And I'm going to get to that point, but I want you to keep in mind who are those patients that you need to get in so that you can get credit for those healthy patients. All right, let's talk about the real basics. And I promise I won't spend a whole lot of time going through this, but what are annual wellness visits? And this is where there is some confusion with a lot of doctors out there and a lot of administrators on what the annual wellness visit is. Sometimes I'll look at a primary care physician and I'll say, how's it going with your annual wellness visit? And that provider will look me dead in the face and he'll say, my annual physicals are going very well. And I think, okay, I wonder what he's doing. I wonder if he's doing a G0438, or I wonder if she's actually doing a physical when she's doing the annual wellness visit. So just keep in mind, these are two different things. The annual wellness visit, and we'll get to it, is a health risk assessment. It's a G0438 and a G0439. And these are the guidelines for the ABCs of the annual wellness visit provided to you by CMS. So this is a 17-page document, and I'm not going to bore you with all 17 pages of the document, but I am going to bring your attention to a couple of really important things in this document. Like I said, I'm not going to bore you. I only have 2 slides, but it is really important. With an annual wellness visit, the first sentence that you can see on the first page of the document provided by CMS, you will see that Medicare covers an annual wellness visit providing personalized prevention plan services for beneficiaries. So for all of you out there that are listening to me right now and saying to yourself, prevention plan services, care plan, we're not doing that. We need you to start doing that as soon as possible, because in order to build this code, not only should you have a care plan, the physician should have a care plan, and the patient should have a care plan. So what is an annual wellness visit? Scroll down to the next arrow and you will see an annual wellness visit is a health risk assessment. A health risk assessment is a complete medical history of the patient's backgrounds. It's things like, those buzzwords like fall risk assessment, whisper tests, BPI, BMI, pain score. It's all those HEDIS measures that are really important to the health plans. Those are in this 17-page document. We could go page by page, but it basically describes what a health risk assessment is and all the things that go into the health risk assessment. Things like, what other doctors are your patients seeing? What type of medications are they on? Who's managing the patient? Does the patient have advanced care directives? What other doctors are they seeing? And the list goes on and on. Medication adherence, colonoscopies, mammograms. We could talk about, the questions that we've added to our software all day long, because there are so many, but it's because there are so many things that need to be addressed during an annual wellness visit. And that's why it takes physicians such a long time to do this visit. So we're going to skip to the next important part of the guidelines. And that's where it talks about coding, diagnosis, and billing. So I want to bring to your attention the two codes that we're talking about is the G0438. Now that's your initial annual wellness visit. Patients only receive one G0438 in their life. So the initial annual wellness visit can only be billed one time, but you can see under descriptors that it says annual wellness visit includes a personalized prevention plan of services. The next code we're going to talk about is the G0439. That's what you're going to call your subsequent annual wellness visit. That's the visit that you'll be coding year after year after year for that specific Medicare patient. Here's what I call the most interesting part or the most exciting part about annual wellness visits and who can actually perform them. Some of you may know this. This may be news to some of you out there. If you look where underneath billing, it says Medicare Part B covers an annual wellness visit if performed by number one is a physician, which a lot of you guys out there have your doctors doing it. The second one says a qualified non-physician. That's going to be your mid-level, your PA, your nurse practitioner. And then the third bullet, I want you all to read this very closely, is a medical professional, including a health educator, a registered dietitian, a nutrition professional, or other licensed practitioner. Or there's that big or there, a team of such medical professionals who are working under the direct supervision of a physician, doctor of medicine, or osteopathy. I can't tell you how many times people have come to me with this question and said, how do you get away with medical assistants doing annual wellness visits? It's right here in the guidelines. It is the third bullet point under billing. It's clear as day, as long as the physician is on the premise. So if something were to happen during this assessment, the HRA, that is the part of the annual wellness visit, the doctor is readily available. So if a patient complains of chest pains, or if the patient reads really high blood pressure, we can reach out to a physician and they can see the patient if something were to happen during our assessment. Okay, so let's go into what are the annual wellness visit requirements. And this is, again, that 17-page document that we tried to make look really pretty for you so that you don't have to go and read through the 17 pages. You're gonna want the patient demographics, the self-assessment of the health, psychosocial risks, behavioral risks, activities of daily living, functional status. We do a hearing test, medical family history. Does somebody in your family have diabetes? Is it your dad? Is it your grandfather? Who has heart conditions? Depression, we do a PQH2. We can also do a PQH9 if a patient is flagged for depression. We want to make sure that we take the vitals, the height, weight, BMI, blood pressure. And a lot of that stuff you want to document in your EMR because you want to make sure, once again, you're capturing those quality measures. Medication reconciliation, development develop a list of patient risks, identification of care gaps. This is another one that's really important to all of you out there because, as you know, closing the loop on those care gaps can help you with incentives at the end of the year, but also more importantly, you're really helping the patient to get to that colonoscopy or get to that mammogram or get that bone density done and help their health. Then there's that thing again about providing a written screening schedule, which is your care plan, and delivering a personalized health care plan based on the patient's unique needs. Things like that include a fall risk assessment, nutrition, physical activity, tobacco use cessation, nutrition and weight loss. So keeping all those requirements in mind, let's go to the next slide. And who is Welltality and what can you do to help me with our annual wellness visits? Well, we recently partnered with Flacos about a month ago, and we're really excited about the opportunity to help all you ACOs out there create more revenue, capture quality measures, and get these patients to their annual wellness visits. And so what we have done, we are a software company. At our core, we are based out of Jacksonville, Florida. We've been around for almost 4 years now. And we are owned by some of the best software developers in the country. They did their research, they did their due diligence, they recognized the need for the tool to do the health risk assessment, the focus on preventative care, the focus on value-based medicine, the focus on quality with the patient, and they decided to create the annual wellness visit software, which we can refer to as the health risk assessment tool that we do for primary care physicians. So the software that we developed is the first version that we built was built for compliance. So it was built to make sure that we addressed that 17-page document of the things that we talked about. What doctors are you seeing? What is your blood pressure? What is your height? What is your weight? And so our software is somewhere between 75 and 100 questions. And it's built with branching logic. So what that means is if a patient is a diabetic, there's 3 or 4 more questions. If the patient is a chronic condition patient, there's a couple more questions. If they're a smoker, there's more questions. If they're a drinker, there's more questions. So at a minimum, our assessment is about 75 questions, and it is built for compliance. And the key word of being built for compliance is that at the end of our assessment, at the end of our 75 questions, our software developers have created a care plan to be generated from that 30-minute assessment of when we've sat with your patient and we ask them all those questions. At the end of that session, the care plan is generated through the software, giving recommendations based on the best practices of CMS, USPSTF, NCQA. It's a conglomerate of all the best practices and what you're supposed to do when a patient has health risk of colonoscopy in the family or breast cancer in the family. And we'll get into that in just a second. I'm going to go ahead and show you an example of what a care plan looks like. So we offer a turnkey solution for busy primary care providers. We provide both technology and service to schedule and perform annual wellness visits, improving patient care and then closing those care gaps. So a few years ago, we created the software and we recognized the need for the doctors using our software. But we also quickly learned that we can go and give this software to all the doctors out there. Are they going to have the time to sit with the patients and spend 30 minutes with them clicking buttons? And we quickly recognized that they're probably not going to do it. So we thought, okay, well, we know with the guidelines that we can actually provide the office a medical assistant. So we have really good software, it's compliant, it creates a care plan, and we can hire medical assistants, train them, who we call wellness specialists, and they can go out to the doctor's office and they can do about 12 to 15 annual wellness visits in a day. And then we recognize, well, wow, this is really great, but I think we need to take it one step further and do a complete turnkey solution for the doctor's offices. And let's handle all the scheduling, because that truly is the hard part to the annual wellness visit. It's scheduling and getting the patient out to this visit. So we decided to do the entire the entire annual wellness visit by building the software, providing the medical assistant, and then handling all the scheduling for that specific office. And so I will get into the solutions that we can offer to you, but what I do want you all to take a look at is a sample care plan. So we're all HIPAA compliant. This is just a sample that we've created of what our software looks like. And this is an example of what our care plan looks like. This is probably 9 of 14 pages on what the sample care plan looks like. So we call this first page, this is what we would call a highlight reel, identifying any health risks that that came out during the assessment with your patient. So for example, if the patient has a health risk with nutrition, you would see that here on this first page. This is what the doctor's eyes are initially trained for when they look at the care plan. Sometimes it's an orange, and sometimes you can see a red. You'll see red for a major risk that has been identified with the patient, or it could be something as minimal as there's room for an improvement. The patient may need to get a flu shot this season while they're in your office today, or when they come back in a week or two. I would say one of the most interesting parts to the care plan, in addition to all the information we get from the patients, we try to make it as easy as we can for the office when it comes to billing. And while we were with your patient, we captured a lot of quality data, and we want to make sure that you get credit for that quality data. So on the second page of our care plan, underneath the highlight reel, you will see billing for HEDIS. So our software generates this based on the questions, based on the responses from the patient. So this specific patient was a smoker. We captured their BMI. We got their BPI in there. We also have a medication list documented in the medical record. The pain severity was documented. We did a fall risk assessment, and the patient and we screened the patient for any other falls. And then, by the way, your diagnosis code is here too. So once the assessment is done, the care plan is printed. This is what goes to the biller or the administrator to bill for that G0438 that day. So we include the G0438 code. It could either be the 438 or it could be the 439. We include any additional, I call them with air quotes, extra credit, those CPT codes that the health plans are looking for. And then there's your diagnosis code in there that indicates body mass index. Okay, so then we're going to go on to the rest of the care plan, and this is where we take a deeper dive based on the responses from the patient. Maybe their nutrition is an issue, maybe it's not an issue, maybe blood pressure was an issue, or maybe the patient is depressed and there's room for improvement. And then we go to exercise, vaccinations, bone health. This is where a recommendation for a bone density test could be done. This is where tobacco cessation could be done. And then this is one that's really popular out there right now because it's a big part of MACRA, and you'll see their advanced directives. So we do ask the patients if they have any advanced directives in place, and if not, that is flagged on your care plan. And then there is your 1 to 5 year screening care plan that not only is the doctor supposed to have, but the patient is supposed to receive as well. And we do, at the end of our assessment, we ask a few questions. One of the 3 questions is, how would you like to receive this? We ask the patient, typically they give us their email, or they like it actually mailed to their mailbox, and we can do that for them. And then the other thing is we have a copy for the practice as well as for the administrator, and you're now compliant because you have a care plan. All right, I'm going to go back to the presentation. Okay, so Welltality has come up with 3 different solutions that we can help you all with. It's just a matter of what works best for you. We have found that our most successful solution is going to be the full turnkey solution where we do everything for you, and I'll get into that in just a second. We've also found that there are some providers out there that are doing a really good job of getting these annual wellness visits done. They may or may not be compliant, but they have a really hard time scheduling patients. So we have something called Software Plus Scheduling, where we can provide the office with the software and we can do all the scheduling for you. And then the third tier is called software plus training. That's where we simply give you the software and all the training that you need, and we allow you to run with it. Let's take a deeper dive into each solution that we can offer you. Okay, so tier 3 is what we refer to as our full service, our full boat, whatever works for you. This is where we encompass the entire G0438 and the G0439. The only thing I need from you is 3 things: a Medicare patient roster, which would be in an Excel spreadsheet. That would be the patient's first name, last name, date of birth, phone numbers to contact the patient, and the Medicare ID. And then you would simply say to me, Ellen, I have availability with this specific room every Monday and every Wednesday. I would like for you to be here every Monday, every Wednesday. This is the room you're going to use, and you can see 12 to 15 patients a day because I'm going to be here at 8 a.m. and I'm not going to leave until 6 o'clock at night. So that is what's called full service. We would upload your patient roster securely upload your patient roster to our portal. We would run eligibility through the Medicare HET system, identifying who is eligible for their G0438 or who is eligible for their G0439. We would then contact, educate, and schedule eligible Medicare patients for that specific day that you told me I could be in your clinic. We'll keep using the Monday and Wednesday example. So when I say contact, educate, and schedule, this is truly the heavy lifting of what we do. We have a team of schedulers that sit here in Jacksonville, Florida. They reach out to your patients on the doctor's behalf or the clinic's behalf. My name is Ellen Heeken. Dr. Smith has asked me to reach out to you and get you scheduled for your Medicare Annual Wellness Visit. And this is where this could be a 2-minute phone call or this could be a 10-minute phone call. Our schedulers are really good in a sense that they are very well versed on what the annual wellness visit is. They are educating patients. They are engaging patients. They are addressing any questions like, well, am I going to see my doctor that day? No, sir. No, ma'am. You will not see your doctor that day unless we have a specific situation where you want to see the doctor at the end of the day. We can do that per clinic. It just depends on how you guys want to make this model work. So we reach out to the patients, we get them scheduled, we talk to them we gather any preliminary data such as medication information. We ask them to bring their medication with them, or at least a list of medications with them and what the milligrams are for those medications, so we can enter that information in our health risk assessment to make sure that we stay compliant. And then when that Monday or that Wednesday comes, we complete the annual wellness visit because we provide the medical assistant who brings her laptop. Hopefully she's been given access to your EMR to do any preventative screening such as colonoscopies and mammograms. And she will be in your clinic, not disrupting the workflow. If you've given her a designated room, she can do somewhere between 12 and 15 visits in a day, seeing patients every 30 minutes and generating care plans at the end of our 30 minutes with our software program. We then deliver that personalized preventative care plan to the patient and the physician. So at the end of the day, your physician or your practice should have somewhere between 12 to 15 care plans that you can go and bill for. The last thing that we try to do to help the office create a further downstream revenue. We can do this. It is not required, but we have a lot of practices that believe in it. And what we do is before your patient ever leaves, she's built such great rapport with the wellness specialist that we've provided. Our wellness specialist will walk them to scheduling and get them scheduled for a follow-up appointment for the physician to review the care plan with the patient 1 week later, 2 weeks later. If your administrator says if they have an upcoming appointment, just let them keep that appointment. And that is where you can do that physical if you want to do the physical for your Advantage plans, or that is where you can address the referrals for the colonoscopies or the mammograms or the bone density or the lab tests. This is where we kind of work with the office on how they want that. This is our full service model. This is the complete nuts and bolts to delivering the HRA, scheduling the patients, and then providing the care plan, and then scheduling any follow-up appointment. This is probably our most popular product, but it doesn't necessarily mean it has to fit your needs. The next solution that we can offer you is for the client that is realizing that or recognizing that they're doing annual wellness visits. They may or may not be creating a care plan. They might be doing 5 a week. Maybe they're doing 15 a week, but they know that they should be doing 12 to 15 a day. So what we do is we provide you with the software and all the training that you need to use the software, and we handle the heavy lifting, which is all the scheduling. So you would still need to provide us with your Medicare patient roster. We would still upload that securely through our software program. Our team of schedulers would still reach out to your patients on your behalf, and we would schedule them for whatever days that you want us in your clinic. We would get patients scheduled. The only thing we don't do with software and scheduling is we don't provide the medical assistant to your clinic to do the annual wellness visit. So some of you are thinking right now, I have a medical assistant who, she's busy 3 days a week, but we don't even need her 2 other days a week. So this would be a perfect solution for you. You could do annual wellness visits 2 days a week, and she could still be doing the medical assistant needs of the day-to-day clinic the other 3 days a week. So software plus scheduling is also an excellent model for the clinics that have the availability with the medical assistants, but are struggling with the scheduling. And the last solution that we can offer you, because we are a software company, is we could provide to you the HRA software, which includes all the scheduling as far as your clinic doing the scheduling. Our software includes the scheduling module, so it's part of the software package. So we could when we give you all the ongoing training on how to understand how to use the software and how to schedule patients through the software. So that's probably for the client out there that's doing really well with their annual wellness visits. They're maybe somewhere between 50, 60%, but you're clearly not creating a care plan, and you may or may not be addressing all the things that are supposed to be addressed in the HRA according to the guidelines that we discussed earlier in that 17-page document. Keep in mind, our software was built, the first version was built for compliance. The second version we built was for that fancy word called HEDIS, HEDIS, all those measures. And then the third version we built was for MACRA. And so feel confident knowing that number one, you're creating a care plan, and number two, you're getting your annual wellness visits done, and you're compliant when you bill the G0438 or the G0439. So those are the 3 solutions that we can offer you. And then just to kind of quickly recap, why Welltality? Well, I hope you're all sitting back saying, why, because we just went through this presentation, and you can't wait to start working with us, but I will just go ahead and quickly recap the benefits of using us. Guaranteed compliance, which I think I've hit home with the annual wellness visit. We did build our software to be compliant. We can complete 12 to 15 AWVs per day. We do have some clients that say they have the room and they have the availability and they need to get their annual wellness visits done. They've asked us to provide 2 medical assistants and they've given us 2 rooms. We actually have a client where we've done wellness days where we've provided 4 medical assistants, and she's given us 4 rooms, and we did 48 annual wellness visits in a day. So we have the capacity to do that if you're under a time crunch and you need to get these visits done before the end of June or something like that. We can increase revenue because you are currently doing maybe 10 or 15 a week, maybe you're doing 30 a week, we can do 12 to 15 a day. The annual wellness visit average reimbursement for the 438 is somewhere between $165 and $189. The G0439 is somewhere between $115 and $125. And because we built our software to meet HEDIS star ACO MACRA measures, we identify those care gaps, allowing you to close that loop with writing those referrals either at the follow-up appointment or at the end of that visit. We can always refer the patient to the referral person, and they can get them set up with whatever referrals they need before they ever leave that day. Improve patient care with early identification and prevention education and patient engagement. One of the things I failed to mention, and I meant to mention, is that the last 2 questions in our software assessment, is, Do you feel that you have been respected, and would you be willing to come back next year and do this again? And I think we have something like a 99.5% rate of return is what the patients say. They build such great rapport with our wellness specialist after 30 minutes of meeting with them that they're fairly engaged and they're interested in coming back a week later to review that care plan with the doctor. There are no upfront costs and no contracts with Welltality. So there's nothing to get started using us. The only thing we really need are the agreements and, of course, the patient roster. And we do not lock you into anything. So, for example, we work with one of the larger ACOs out of Tampa, Florida. And at the end of last year, he has probably, this specific ACO had probably 5 or 6 groups that were not meeting attribution. They were not getting their annual wellness visits done. So we sent out medical assistants at the end of the year to get their 50 or 80 or 150 annual wellness visits that needed to be done before the year was over. And then we're now working with a lot of those clients with their other Medicare patients that are not a part of the ACO, but we don't lock anybody in. You don't have to be with us for 1 year or anything like that. We don't do that to our clients. Okay, and let me get to the last page because I feel like I'm probably running a little long here. All right. The quick commonly asked questions. Just to get through those real quickly, how do you make your money, right? So this package sounds fantastic. How is it that you guys make your money? We take a flat fee depending on which tier you select. So we have a flat fee based on the reimbursement. We take a little bit more than what the half of the reimbursement is, but we can talk to you individually about that based on your volume and your Medicare patients, how many patients that you have, the volume of your practice. One of my favorite questions, but who does the billing? Who does all the billing? People say that to me all the time. You do all the billing. We can help you with billing. We have a billing specialist that can help you, but you do all the billing. If you were to choose our full service model, our medical assistant would deliver 12 to 15 care plans to your administrator or your biller at the end of the day with an encounter form before she ever leaves the practice. And your billing company or your in-house, whoever does all the billing, you would do all the billing. The code is there. The CPT codes are there in addition to the diagnosis code. So you do all the billing. We electronically bill you 1 month from our first day in clinic. So we have a portal that tells you exactly which patients we've screened for whichever code it is, whether it's the G0438 or the G0439. And we can tell you exactly what our price was. And all of this is through our portal. And we deliver an electronic invoice to you 1 month after we start working for you. So here's something that I know that people are thinking, what if I don't get reimbursed? What if we don't get paid for that claim? So we do not get paid unless you get paid. And we say this and we believe this and we stand behind this because it is so rare that you will not be reimbursed for a G0438 or a G0439. So what happens is, let's say you bill patient Mrs. Smith, and you bill the G0438 and it comes back declined. We will ask you to rebill the subsequent code, which is the G0439. And I would say 99 out of 100 times it will get reimbursed. If for some reason you do not get reimbursed, we will credit you and we will not ask that you pay for that claim that we did. Next question, how soon can you be in my clinic? So let's say you're thinking, wow, this is great. I'm really excited. We want to do this. All I need from you is to sign our agreements. And I would need for you to upload the Medicare patient roster, which is what we spoke about, which is the first name, last name, date of birth, phone numbers, and Medicare ID of your patients. We upload that securely, and it could be anywhere from, in the scheduling side, as early as a week. If you want us to do full service, it could take anywhere from 2 to 3 weeks, depending on if we have a medical assistant that's in that area that you're interested in us becoming a client. What about Medicare Advantage patients? Absolutely. Absolutely. In fact, I think the Medicare Advantage patients, the reimbursement is typically a little bit higher. I've seen as high as $191. And then if you couple that with a physical, it can be closer to about $300. Now, obviously, we can't do the physical because we provide medical assistance, certified medical assistance to our wellness specialists. But the Medicare Advantage patients, we can absolutely help you with. We help with Medicare Part B and replacement plans. What type of agreement do we have? There are two agreements. There is a typical business agreement, which just protects both parties, as well as allows us to upload your Medicare patient roster, and we are all HIPAA compliant. Just describes that we're all security trained and that we're all HIPAA trained. So there is a business agreement, and then the other agreement is just a screening agreement, which outlines what we do and what our services are, and discusses the compensation and the screening and how our medical assistant is employed by us, and we provide them to you kind of like a staffing company. And then the last question is, how do I get started? All we need in order to get started is the agreement signed. We upload the patient roster, and then we can be in your clinic as early as a week if it's for scheduling purposes and you guys do want to keep the software. If you want us to do the full service model, it takes about 2 weeks because we like patients to have about 7 to 10 days for them to get scheduled for us to provide the medical assistant in your clinic. All right. And that is my presentation. Thank you all so much for listening. I really appreciate it. Sam, I'm guessing I'm going to turn it over to you for any questions that may have come in if I didn't answer them at the very end.
Yes, ma'am. I do have 2 questions for you. So the first one we have is from Dennis, and he asks, does HEDIS provide annual wellness visit benefits verification status for Medicare Advantage patients or only straight Medicare patients?
So that's a very interesting question. So I'm going to ask you to read it one more time, Sam, because all the health plans have these HEDIS measures, but all the health plans are a little bit different. You know, one may weigh diabetes heavier than another plan weighs diabetes. So will you read me the question one more time?
Sure. He asked, does HEDIS provide annual wellness visit benefit verification status for Medicare Advantage patients or only straight Medicare patients?
Oh, is he referring to the HETS Medicare system? HETS?
Or HETS, I'm sorry, yes, HETS.
Oh, correct, okay.
Go ahead, Terry.
Sorry.
So
yes, sorry.
The short answer to that is yes, if they have a straight Medicare number, then we can typically get valid eligibility through the Medicare HETS system. The one thing to be aware of with that is the charge lag. So if this patient had an AWV a month ago, the Medicare HETS system may not recognize that.
Okay, great. Dennis, did that answer your question? Okay, he said yes, perfect. Next question is going to be from Ken. He asked, can this service be provided by a clinician in the field if operating under the direct supervision of the physician?
Yes, absolutely. Absolutely. Yes. So some of the people out there may be thinking to themselves, gosh, I've got, our ARNP who wants more hours, but, we only have her 3 days a week, but she wishes she was here on Thursdays and Fridays. Absolutely. Absolutely. An ARNP could do it. A PA could do it. A medical assistant could do it. A CNA could do it. So absolutely. The answer to that is yes. Just keep in mind, it's under the direct supervision. So the doctor needs to be within reach.
Gotcha. Okay. Ken said thank you. The next question is coming from Andy, and Andy asked, are there any considerations for services done in a SQHC or RHC?
Great question. Great question. So we have a couple of FQHCs. We love them. They're great. The one thing that is different for FQHC, and I can speak to Andy specifically if he wants me to, is at the end of our 30-minute visit, the physician or the provider does need to step in for about 5 minutes. We have a large group up here in Jacksonville that I would be happy to refer Andy to discuss, to either get a reference or to learn a little bit more about that process. And I can email him separately who it is to speak with and what they do as far as workflow goes. But the provider does have to see the patient at the end of the visit, at the beginning or at the end of the visit. And the payment does, vary with FQHCs. That's another thing.
Okay, great. And he did have one more question. He also wanted to know, can the annual wellness visit be billed as an incident too?
No. So it's a completely different benefit code. So the G codes are completely different than incident 2. So what he's probably thinking is, if a PA does it, it's considered incident 2. But the G codes are a completely different benefit code. It has nothing to do with incident 2. So there's not like a less reimbursement or anything like that because a medical assistant is doing it. And again, if he wants to reach out to me, I can discuss this with him. I have all the legal documentation to explain. Incident 2 is completely separate from a G code and a medical assistant doing it.
Yeah, I will introduce him to you after the call. So
great.
Not a problem.
Great.
If anyone has any more questions, just go ahead and type in your questions and I will make sure Ellen gets them. If not, I just wanted to take a moment and thank our business partner, Welltality, and Ellen and Terry for putting on this great presentation that they have done for us today. Also, once you exit, you'll receive a survey on the presentation. We would definitely appreciate if you would complete that and provide your feedback. I will also be sending out an email with her contact information. If you have any follow-up questions, you can email Ellen and ask them to her. You will also get a link with the webinar recording. So please feel free to share that with anyone you may think may be interested. Also, I wanted to update everyone that we will be releasing early registration for our fall conference coming up in March. So please be on the lookout for our emails. We have the date set. It'll be October 18th and 19th in sunny Orlando. So thank you again for your attendance and thank you again to our business partners, Welltality. We hope you all have a great day and take care.
Thank you so much, Sam. Appreciate it. Thank you.
Thank you. Have a great day, everyone.
Yeah.